About marmas, I talk about the vascular marmas in the end. We all know there are 5 divisions of types of marma points: mas, sira, snayu, asthi, sandhi. Okay. Out of these 5 types, the sira marmas are the ones which needs to be taken extra care about. Okay. So, because the application of pressure, the direction of application of pressure, and sometimes it is indirect pressure, not directly applying on the same side, one has to be more careful about. But these are the points which even a layman can practice after certain guidelines. Okay. So these 4 marmas I stimulated. Now I'm going to explain all these, how to locate these 4 points and how you can do self-marma therapy and clinical therapy. Basically, marma therapy is divided into 2 types. One is the simple self-treatment, which anyone can do, and the other is the elaborate clinical therapy, which should be done by practitioners or doctor. So we can be divided into 2 types. The best part with self-marma therapy is when you are doing stimulation of the marma points, you are not stimulating, or you will not exert any extra pressure on the point, because once it starts hurting, then you will do, no, I cannot do this. So that also acts as a protective mechanism, you see. But for clinical practitioners who are not very trained and do it in the wrong side, then of course there can be chances of complications. What complications can happen, that also we will discuss. The Ans marma, Kakshadhar marma, Purpar marma, and Chakra marma. These I am going to explain in terms of frozen shoulder, but it is not that we apply these marma points only for frozen shoulder. Okay, we do apply this for other diseases. For example, cervical spondylitis. Out of these, we do 3 points. The only difference will be if the frozen shoulder is of one side. We all know, we are already seeing what frozen shoulder is, so I don't need to elaborate it. Okay. If it is of one side, then only one side of the arm is to be stimulated. Okay. But if it is cervical spondylitis, pain due to cervical spondylitis, then we do both the sides marma points. Out of these 4, we'll do 3, like Ans, Purpar, and Chakra. These are the 3 points which we do generally for cervical spondylitis. When sometimes patients are having cervical spondylitis, pain radiating to the occipital region, then we include one more, that is the Trikartika marma. Okay. Out of these 4, if suppose you wake up in the morning, you have a stiff neck, okay, and then you need to sometimes take painkillers, go to physiotherapists, and it again takes more than a week, maybe sometimes 15-20 days for the next pain to go. But out of these 4 points, if you can stimulate Ans and Purpar, there is a remarkable reduction in pain and immediately. So in 3-4 times, if you do, the next pain goes. So you will not need to take any painkillers or muscle relaxants. Okay. Similarly, out of this point, Purpar marma is one of the points which we are doing for tennis elbow patients. Okay. Then it is combined with another 2 more marma points which I am not discussing, depending upon the time frame that I have. So at least these 4 points we will carry home the identification method, how to locate it and how to stimulate it. And anybody who was willing to come and volunteer, slightly inwards, to move it slightly inwards. Do you have a pointer? Pointer. Okay, what I want to say is if you extend your arm like this directly backward, there are certain nerves here, so you don't press exactly at that side. You press slightly backwards towards the neck, but don't go exactly at the side where the neck joins the shoulder. Okay, so if you press here exactly at the side where the neck joins the shoulder, the chances of giddiness and dizziness is there. So that is to be avoided. One must not press close to that point. Also, another important factor which when stimulating the Ans Marma is both of them should never be stimulated together, only one by one. If you stimulate this together, then again the chances some patients can become unconscious. So both of them should never be pressed together, right? Now the next question arises, how much amount of pressure and which direction? So what we do is, the direction of pressure is from this point, you make an imaginary line towards the sternal notch. Okay, and along this imaginary line, you press, right? Press and release, press and release. It is an intermittent pressure, not a continuous pressure. Intermittent pressure, not a continuous pressure. In the same rhythm in which we take our breath in and out. Okay. So one press and release takes approximately 3 seconds. Okay? Because our breath rate is approximately 18 times per minute. So one press and release takes approximately 3 seconds. Now the next question is, what is the amount of pressure? The amount of pressure that is applied varies as per the marmas. If the marma type is of vascular nature or sira marma, then very mild pressure is applied or sometimes no pressure at all. The rest of the 4 types, that is mans, snayu, asti, sandhi, you can apply moderate pressure. Some variations in pressures will be there, but overall, the rest 4, moderate amount of pressure can be applied. Now, your next question again is, which marma with how much amount of pressure? So, on each marma point, it is not the same amount of pressure. Some variations are there. For example, in case of Ans marma, we apply approximately 8 to 10 pound pressure. None of the books so far tell you how much pressure application is to be applied. Okay? Now the next question again is, how do you identify pressure? How do you know that this is 8 to 10 pounds? Again, not a difficult task. It's very easy. You can just put your thumbs on a weighing machine and see how much pressure is there in the weighing machine, and it is approximately the same amount of pressure that you applied. Is that clear? So see, these are some of the very simplistic queries that I come across in different workshops, and these are the points. If there is anything else, I will add up. So this one, you can again, this is self marma therapy. You just press it here, and then directly with the help of pulp of middle finger and index finger, you apply pressure. Press and release, press and release. If I have a video, I'll take the video and you can see. So there's sound in it or not? Sound. As you can see, I am putting both the fingers together, but I am not pressing both of them together. The neck has to be straight. It should not be down. You will have some pain. You will have to bear with me for 1 or 2 minutes. Right? This lies on both the sides of the elbow, both on the lateral aspect as well as on the medial aspect. The patient should be empty stomach. If the patient is not empty stomach, then the chances of nausea and vomiting is there. And some patients can have giddiness again in this one, because this is painful. So you must do it in supine posture, especially in those patients who are hypersensitive. Those patients who are hypersensitive, you must do it in sitting, supine posture, not in sitting posture. In other patients, if the sattva is high, if the patient is a pravar sattva, you can do it in the sitting posture. Okay. In case of diabetics, one must not do it in empty stomach, completely empty stomach, because such patients can land up into hypoglycemic shock. So, in case of diabetic patients, we generally ask the patients that you must have taken something around 3 hours back. Okay, and also do in diabetics only or hypertensives only in the supine posture, right? So far I'm clear? Now, yeah, so far, next, like the identification of this Marma point. So the identification is if you fold your elbow, then you get an elbow crease. Okay, this is the elbow crease. So just on the lateral aspect, just on this side, medial aspect, one finger below this elbow crease, and one finger below this elbow crease on the lateral aspect as well. As I have shown in the picture, I will show the video I have, the Cooper-Marma stimulation, so you can visualize it better. Okay, sound is not there, otherwise. Anyway, I will be showing it on him, so you will be able to see. So you draw an elbow crease line like that, okay? So one finger breadth below this. So when I'm doing it, I'm holding it the other arm like this and putting the inner aspect of the thumb. I'm not using the pulp of my thumb. I'm using this side of the thumb, inner aspect of the thumb, and the direction of pressure in this is make an imaginary line from here to the olecranon. Okay? So you draw an imaginary line from here to the olecranon and then apply pressure in that direction. Okay? So this is again same way, pressing and releasing. So it's not a downward pressure, it is slightly upwards and towards the olecranon. The elbows should be slightly flexed. If you keep the elbows straight, stout, then the muscles become stout and it's not very flexible and not very easily accessible. So you have to keep the elbow around 15 degrees flexion. Basically, the identification is 2 finger breadths from the webbing in between the index and the middle finger. We put 2 finger breadths below. When I'm talking about finger breadths, it means your finger, not mine. It's the patient's finger, not mine. Okay, because Shishir has mentioned about the angul praman and all those things. So when the angul praman is mentioned, it is the patient's. And now one standardization has been done for angul praman, which is 1.96. It's considered as 1.96 centimeters. Of course, there will be variations in different angles, but if a large data was collected and the number of angles or measurement was done, so it was considered 1.96 centimeters. Now, again, the question arises, which angle? Whether this angle or this angle? This finger or this finger? Index finger. Which one? Which finger? Index finger. No. It is, you combine all the 4 fingers and take the base and divide it by 4. That is one angle. Okay? So then you get an average of the 4 and then that is one angle praman. Right? So approximately 2 finger breadths above in the middle, you go back and put your index finger make your index finger like a hook and put it on the thenar eminence. This is the thenar eminence. So you put your index finger here, and generally what people do is press it directly backwards. What I do is I press it slightly towards the thumb. You get slightly more tenderness. All Marma points are tender to some extent or the other. Some are more, some are less. More is the Cooper and the one in the ankle. So what I do is just slide slightly towards the thumb. Press and release. Press and release. Okay? You can do it like this. If you place it on the center of the palm, then you will not be able to do it. So you have to place the index finger on the thenar eminence and then try to assess it. Okay? Slightly around 15 degrees towards the thumb. So these are the 4 points which are very important, and then I will now explain on the patient so you can see. And Kshetra Marma is also very important because in medical practice, when you are doing when you are applying the pressure from this direction to this direction, the actual site will not be exactly from this to this, but the direction will go somewhere in the midline of the body. But it is difficult to tell you where the midline of the body is. So you should try to stimulate from this direction to the sternum notch. दिक्कत होगा तो बताइए मुझे, ठीक है? Do you also have cervical problem? Cervical spondylitis? Any other problem besides this, no? Right knee. आपको left में ना? Okay. Only, as I said earlier, only one side, but Ansman we do both sides. Okay, so now the next one will be the Kakshadharma. So this one you can see from the front side. Left one, So from 4 fingers in the back, and then press. Take deep breath. First, start with the self-Marma therapy, and then once you have gradually learned, and then you can, of course, incorporate into your clinical practice, right? The overall time taken is generally hardly 4-5 minutes in one sitting. So the best part is, again, in the fast-moving world, people don't have much time. So this is the best, one of the major benefits of Marmas. And yeah, thank you once again, and I hope more of you will come.
Thank you so much, sir, for an amazing thing. And as sir said, Pratyaksham became Pramana. And I would request Harishankar Sharma Dadaji to felicitate Dr. Shishir Prasad sir with a memento for the live workshop. As in the morning session as well, I said, like, Marma Chikitsa is one of the very unexplored area of our yoga. And we need people like Dr. Shishir Prasad to enlighten us with such topics.
Thank you.
Thank you so much. Moving forward.